Hi, I'm Elizabeth Hess. I'm here with Julie Pryde. She's with the Champaign-Urbana Public Health District. And Julie, I know you're aiming for 100% vaccination rates, but right now you're going to be satisfied if you hit close to that with the 65 and older. How are you doing with that group?
Pretty good. We're up to almost 80%, or nope, almost 78%. So we're getting there, but that's still a lot of people who are left unprotected. And the way things are looking, it seems like just because a lot of people are getting vaccinated, everybody thinks it's just kind of time to run wild, but it really isn't. Unless you're vaccinated, you're not protected any more than you were a year ago.
So people who got together for Easter, it's still not completely, I mean, even if all the adults have been vaxxed, the kids haven't. So you still have to be careful. And every adult needs to be at least 2 weeks post-vac, right?
Correct. Yes. So, I was lucky enough that everybody at my event, except for the little kids, were vaccinated. So that was nice.
What about seniors who are afraid of getting the shot? I've talked to a couple for whatever reason, they're afraid of it. They were afraid of misinformation. They may watch the wrong kind of news networks, or maybe they can't even get a ride. Like, what do we do to help get the other 22% over the hump?
Well, I think the best thing for anyone who's still concerned about getting the vaccine for whatever reason is to talk to their healthcare provider. Just call your healthcare provider, ask to speak to a nurse or someone there and get your questions answered. You can also call me directly here at Public Health, 217-531-5369, and I will get you on a list to make sure that our schedulers call you back to get you in for a clinic. We have options available for people so that they don't have to come into the building if they don't want to. If it's easier for them to remain in their car, they can let me know that and let schedulers know that. And then we will have a nurse come out to the car and give them the vaccine while they're still in their car. Then they'll wait in their car 15 minutes while staff watches them, and then they'll be on their way.
CVS and Walgreens get shots intermittently as well. As you drive around town, you see those signs. Who is eligible to receive those? What age group are we down to now?
Right now, we're in Champaign County, everyone 16 and above is eligible to be vaccinated regardless of condition. So the important thing to know, though, is if you're 16 and 17, the only vaccines that have so far had the emergency use authorization from FDA is the Pfizer vaccine. We do look for other ones to come online soon, but right now it's just Pfizer. But everyone else is every other adult in our entire county is eligible to get the vaccine. They just need to get on the list and take it as soon as they can.
And I have read this weekend that 11 to 15, the studies look really good and they're encouraging. Do you have any idea of time frame for when those of us with kids in that age group can breathe a sigh of relief and inject them with a vaccine?
Well, Pfizer will be the first, and I think that they are probably within a week or so, is what I've heard, a week or so, maybe two, of applying for the emergency use authorization. So Pfizer will be first, then Moderna, then Johnson & Johnson, because it'll go the same way that they were released. It's whoever is ahead of the game. But I look for that to be coming out probably in the next couple of weeks.
In the community, we all have a lot of friends. We know people with kids and grandkids that aren't in that age group yet, 0 to 11. Is that a possibility? Do we just have to wait? It could be a year or less. Do you have any idea when kids will be safe to vaccinate?
I'm still thinking it's going to be at some point in the fall, but it's hard to know. Again, it'll be Pfizer first because they will be the ones, they're already testing in that group. So is Moderna. So it's just they have to get through the studies, and once they see that they are both safe and effective, then they will apply for the emergency use authorization, and then the kids will be eligible. So we're just getting as many people as we can vaccinated until that time. Ideally, by the time the kid vaccines are out, the ones that are approved for them, we will just be worried about getting them vaccinated, and we will have the vast majority of adults vaccinated.
So we're looking at herd immunity nationwide. However, some governors seem to be taking the pandemic less seriously and have no mask restrictions. Michigan seems to be on the other side of that. They have a governor that did have restrictions and closed things down. However, in the last week, they went from 600 to 8,000 cases. Why are some states spiking and others aren't?
We're in that second, or it's actually the fourth, we're in another wave. And, if you look at the stats, they go up and down based on a variety of things. We will see a lot of spread we're seeing a lot of spread in younger people. And then, of course, then that gets farther out into the community. But these variants, especially B117, is way more infectious. So if you're not vaccinated, even if you didn't get it before by doing certain things, you are definitely still at risk for getting it. I mean, it's nothing to take a chance with. So if you're not vaccinated, you need to be very careful, just as before, because we are going to continue to see cases, climbing. I would love for our county not to see that, but, it's going to be just like it was before. It's going to be traveling around the country in different places at different times. But once the variant gets there and starts spreading, if they're not doing a really high level of mask wearing and distancing, it's going to take off even faster than it did, earlier in the years.
Pandemic fatigue has set in, luckily in time for us to be outside, but a lot of people went away for spring break. A lot of people, I know an alarming amount of people that just wanted to get away and went to Florida of all places, but only 17% of this country has been vaccinated. Do you have any control to ramp up the vaccine efforts of our surrounding states at the very least?
No, the problem is just the amount of vaccine that's out there. I think that, there are some places where they're just not having a high uptake of the vaccine. That's not the case in our county. I keep saying we're still at the point where we have way more demand than we do supply. So people are still wanting to get the vaccine. It's just we don't have as much as we would like, where we can just do 7-day-a-week clinics all over the place. That's what we would like to see, but we're just waiting for more vaccine like the rest of the country.
And there will be a point in time, just help me have a light at the end of the tunnel, where you have more vaccines than everyone who wants it and can get it will get it, right? We will reach that point.
Yes. Yeah, we will reach that point. And in our county, again, I'm really happy to see that the numbers are so high of people that are interested in getting the vaccine. So we definitely will get to that point. When exactly, I don't know, because we keep being told that the vaccine supply is going to ramp up drastically. Once that happens, we'll be able to crank them out really fast.
Last question before I let you go. COVID-19 was the third cause of death last year behind cancer and heart disease. I'm not usually at a loss for words, but there are people in my life that still believe that hospitals are inflating money or doctors are inflating the numbers of people that died of COVID for some kind of financial windfall. I don't really understand it. What should I say to people that think we're inflating the COVID numbers?
Good luck. I'll tell you what, if you figure out, Elizabeth, what you can tell them to break them out of their delusional belief cycles, feel free to let me know that, because I don't know what they are. There's just still a lot of information out there. Some people are not going to have their minds changed regardless, but we do want people who have legitimate questions to hopefully get those answered. And, if you're asking a question, we're going to be happy to answer it. The same thing with healthcare providers. If you have some questions about your own concern about your individual situation, just reach out and ask those. But other than that, I don't know, because I've heard some really interesting things that are simply not true, but they kind of take on life of their own.
So if you're 16 and older in Champaign County, you are eligible for a vaccine. Keep checking the Christie, the CUPHD, the Carl sites, and sign
Walgreens, OSF, Francis Nelson, or Promise Healthcare. All places have vaccine. CUPHD, we're not doing clinics in the normal sense. What we're doing is having small clinics where we're getting people in who are having difficulty getting in through some of the other sites. So we have 65 and older. If people have any type of language barriers, cognitive or other type of disability that makes it difficult for them to go to one of the larger clinics, then we're happy to accommodate.
All right, give the phone number again. I know Jason will put it on a graphic, but what is that phone number again?
It is 217-531-5369. If I'm not here or if it's after hours, just leave a message and I'll call you back the next day, or I'll have the schedulers call you. All we
Jason
need
Liggett.
is your name and your phone number.
Name and phone number, and call that number. Jason Liggett, who I just mentioned, thank you so much for continuing to produce these segments. Thank you, Diane Marlin, our partner in this, of course, the mayor of the city of Urbana. And Julie Pryde, I know you're really modest, but you're the reason that a lot of us get a full night's sleep in this county. So I don't think you're—
Because I'm boring. Thanks.
Thank you for all that you do. We would not get through this pandemic without your leadership. And I know it takes a village, but you're our leader. So thank you for all you do.